A hernia is the protrusion of an organ, or the fascia of an organ through the wall of the cavity that normally contains it. There are different kinds of hernia, each requiring a specific management or treatment. By far the most common hernias develop in the abdomen when a weakness in the abdominal wall evolves into a localized hole or defect through which adipose tissue or abdominal organs covered with peritoneum may protrude. Another common hernia involves the spinal discs and causes sciatica. A hiatal hernia occurs when the stomach protrudes into the mediastinum through the esophageal opening in the diaphragm. Hernias may or may not present with either pain at the site, a visible or palpable lump, or in some cases more vague symptoms resulting from pressure on an organ which has become stuck in the hernia, sometimes leading to organ dysfunction. Fatty tissue usually enters a hernia first, but it may be followed or accompanied by an organ. Symptoms may or may not be present in some inguinal hernias, while in some other hernias they are. Symptoms and signs vary depending on the type of hernia. In the case of reducible hernias, a bulge in the groin, or in another abdominal area, can often be seen and felt. When standing, such a bulge becomes more obvious. Besides the bulge, other symptoms include pain in the groin, that may also include a heavy or dragging sensation. And in men, there is sometimes pain and swelling in the scrotum around the testicular area. Irreducible abdominal hernias or incarcerated hernias may be painful, but their most relevant symptom is that they cannot return to the abdominal cavity when pushed in. They may be chronic, although painless, and can lead to strangulation. Strangulated hernias are always painful, and pain is followed by tenderness. Nausea, vomiting, or fever may occur in these cases due to bowel obstruction. Also, the hernia bulge in this case may turn red, purple, or darken pink. In the diagnosis of abdominal hernias, imaging is the principal means of detecting internal diaphragmatic and other non-palpable or unsuspected hernias. Multi-detector CT/MD-CT can show with precision the anatomic site of the hernia sac, the contents of the sac, and any complications. MD-CT also offers clear detail of the abdominal wall, allowing wall hernias to be identified accurately. Most of the time, hernias develop when pressure in the compartment of the residing organ is increased, and the boundary is weak or weakened. Weakening of containing membranes or muscles is usually congenital, which explains part of the tendency of hernias to run in families, and increases with age. For example, degeneration of the annulus fibrosus of